broke my nose over the weekend. What should I do?
I'm so sorry to hear, but if you haven't yet, I would recommend going to the emergency room initially right after the injury. What they can do is assess the injury to make sure there's no other surrounding structures that were injured, such as potentially the facial bones or even a concussion. But right now I see that you have some swelling on your nose and some bruising around the eyes, and that's pretty common, especially after nasal fractures. What we want to do right now is let that swelling and bruising resolve. That will give me a better sense of what the shape of the nose is. Second thing is, how's your breathing? If you have some congestion early on, that's pretty common, especially with the swelling related to the trauma. But occasionally some structures inside the nose can get damaged as well, specifically the nasal septum, and that can potentially need to be fixed. Fast forward, if we look at your nose in 2 weeks from now, what are our options? If your nose is functioning well in terms of breathing and you have a significant curve in the top third of your nose due to a fracture, sometimes doing what's called a closed reduction can be very useful, in which we just use that fracture line and reposition the nasal bones. Most of the times patients might require some formal repair to the septum or nasal bones, and for that treatment, I tell patients there's really no deadline. That's something we want the nasal bones to heal a little bit more to get a better understanding, and a formal repair can be done at elective time.